alaikum and a very good morning to you all and a happy Monday, happy start of the week. I hope you guys had a wonderful weekend and you're ready to have a productive few days.
Wow, amazing that is. Hi, hugs and hello from my side as well. And
Hi,
from
Shazad.
hello, Maha. How are you? Thank you very much, everyone, for tuning into PT World. You're obviously watching well this morning alongside these two amazing people, and we name ourselves as Shazad and Maha as well. So thank you very much once again for tuning in. But today, Maha, is a very important day, and as anchors or as hosts, we might have played around, but we do not want to because of the fact that the information which will be shared on live television today has to do something with to be very honest, your health, and then at the same time awareness, and then that is what is our forte. So yesterday, it was 8th of May, and then the best part was that if probably have you been driving around in Islamabad, you might have seen those banners on each and every one of the poles, which are actually by Battlemal, and they are doing a great job in terms to provide some financial benefits to all of those people who cannot really afford to treat thalassemia.
Exactly.
And yes,
Continue.
yeah, it's all right.
Because yesterday was World Thalassemia Day and today we are observing it because we want to raise awareness and actually find out what is it, what's happening in Pakistan, can it be prevented, and in comparison to the rest of the world, how we faring.
And I think as far as my research goes, I think it's a gene disorder within babies, and it is because of the fact that, there are people who are carriers, and then I think cousin marriage can be one of those very valid symptoms of, or probably the causes of thalassemia as well. But we've got experts over here in the studio who will be talking about it, talking about the disease, what can we do, and then since there are a lot of transfusions involved in it, because that's the only cure, I think, we'll ask obviously, but then at the same time, do we have enough blood donors? That's what the question is, and how will we reach there? Because 7% of the total population of this world is suffering through thalassemia.
Exactly.
So let's take an insight.
Exactly. So for that, to start the discussion, we have been joined by Dr. Uzma. She is a psychologist. Assalamu alaikum. Thank you so much for joining us.
A clinical psychologist.
Thank you.
Hello, how are you?
I'm fine.
And she will be explaining to us, the psychological impacts, how the families can keep their hopes and will, and, be strong. Besides Dr. Uzma, we've been joined by Dr. Munawar Sher. She is the president of the Pakistan Hemophilia Patients Welfare Society. Assalamu alaikum. Good morning. Thank you for joining us. Besides Dr. Munawar Sher, we've been joined by Dr. Lubna Zafar. She is a professor of hematology at the Foundation University Medical College. Assalamu alaikum, good morning. Thank you for joining us.
My sister studied from your college though.
Okay, thank you for inviting me.
Besides Dr. Lubna, we've been joined by Dr. Tahira Zafar. She is a consultant hematologist and she is the medical director of the Pakistan Thalassemia Patients Welfare Society. Assalamu alaikum, good morning.
Assalamu alaikum. Thank you very much for coming over for a greater cause as well, and only women.
Yes.
It's perfectly all right.
You are not women, you are the only male one.
I am literally feeling special, but moving on to the conversation. First of all, I would love to know what your society is doing in terms of thalassemia and its cures.
Thalassemia is, as you've just actually mentioned, it's a genetic disorder. So it's a inherited blood disorder in which genes are passed from parents to offspring. And most of the time, the parents actually who are carriers, they know about their being carriers when they get a child with thalassemia.
Okay, so I'm going to go back a bit, going to rewind a little bit, but let me start with, let's speak to Dr. Lubna. What is thalassemia? Like exactly what is it?
Thalassemia is a hereditary blood disorder in which the person who is suffering from thalassemia actually gets anemic. So means that he has a low hemoglobin and needs to be transfused or some other treatment.
So hemoglobin, for all the non-medical laymen, people not understanding it, that's the blood count.
Yes,
right?
the blood hemoglobin level falls because these patients, they are incapable of making enough hemoglobin because it's basically a hemoglobin disorder and a hereditary one for that.
Right.
Okay, and it is because of the fact that that your parents might have been any one of them or both of them were carriers.
Yes, this is an autosomal recessive disorder, means that if both parents they have a defective gene, then there is a 25% chance in each pregnancy that the child may have thalassemia major, which is the serious form of the disease in which these patients they need blood transfusions to sustain themselves.
Okay. Oh, so Dr. Tahira, what are the statistics of thalassemia within Pakistan?
In Pakistan, like we were talking about earlier, Pakistan is not yet a thalassemia-free country. There's lots of thalassemics around.
Yeah, and I think there's media out there that are saying that it is thalassemia free.
No,
but
that's why I
not
actually
correct.
mentioned that, because that's where the fight goes on to
Yes.
make it become a thalassemia-free country.
Alright.
So according to our national statistics, there are around between 50 to 100,000 people who have thalassemia major. And the carriers, 5% of our population is thalassemia carriers. So there's like a million, it's about 80,000 or so people who are carriers. And then 5 to 6,000 patients are born with thalassemia every year.
Alright.
Okay.
So that's a huge number.
Okay, but then, for example, since we are saying that it's a hereditary disorder,
Yeah.
so that for all those people who are carriers, how
Yeah.
can they screen themselves that whether we are carriers or not?
This is where the awareness comes.
Okay.
Because the carriers are otherwise completely normal. And as I said earlier, they only know that they are carriers when they get a child. When two carriers are married, they get a child with thalassemia, and then when they are tested, it turns out that they are carriers as well. So they are completely normal. But the good thing is that it's very easy to detect carriers, and with 5% of population being thalassemia carrier, and especially with families who have thalassemia gene in them, they can be screened, and screening is done by just a simple blood test, which will cost around 200-300 rupees, which will tell the clinician that maybe this person has thalassemia, and then a special test which is called HB electrophoresis is done to confirm this. So
Okay.
by not spending a lot, you can actually
just about to
know
ask.
that you are a thalassemia carrier.
Okay, now for a lot of people out there, it's not on their, list, top of the priority list to go and get tested for thalassemia.
Yeah.
So a lot of people learn the hard way, they get married, they have a child. What are the signs that you can tell that your child is suffering
I mean, the children who are born with thalassemia, like thalassemia majors, we call them thalassemia major, they actually, at birth, they look normal, but within a few months or so, because it's a blood disorder, their red cells are abnormal, their hemoglobin is bad, they don't get enough hemoglobin there to support them. So there's growth retardation, they start becoming weak and start crying and all that. And weak and growth retardation is the main symptom. That's when the parents actually bring the children to us saying that, oh, doctor, see what's happened to the child. And then when we test.
And is it from the very beginning as well?
It's an inherited disorder, they're born with it. But within a few months, most of them are actually diagnosed as having thalassemia.
Okay, but then at the same time, as I earlier mentioned at the start of the show as well, is it because of very common cousin marriages?
I was actually going to comment, and that's an excellent question, because the concept is, cousin marriages. It's not just cousin marriages, because 5% of population actually has thalassemia gene.
Okay.
And it has happened in the past that people have said, I'm a carrier, I'll marry outside the family, and lo and behold, get a child with thalassemia. So the important thing is to know that you are a carrier and not to get married to a carrier, whether it's within the family or outside the family.
So then the carrier is not going to get married ever?
No.
No.
The carrier can
they can't marry a carrier.
A carrier.
They shouldn't.
Two carriers should not get married.
They shouldn't.
If they love each other, or if they've been arranged marriage, whatever.
Yeah, that's another very good question, because it's not just
there is hope for them as well.
there's hope
There
for
is
them
hope,
as well.
okay, great.
That's right. And the hope is that they can actually, before the birth of their child, they can actually get themselves checked, which we call prenatal diagnosis, to see that whether the child has thalassemia major or not. And I'm just letting you know that 75% of the children would 50% will just be carriers, so they'll be normal. 25% will be normal, totally normal, without even the gene, and it's only 25% which will actually have thalassemia.
Right, okay.
So they still have hope.
Okay, so now let's move on to the more welfare of these patients, and then we'll come to the psychological part of it. But Dr. Munawar, what is happening when these patients or the parents of the patients come to you How do they handle it? Are they aware? What's the situation?
Because it's only the 5% of the total population who can actually afford to, go through all of the processes and then the economical burden.
Dekho, you have to think not in percentages when you think from the heart. You can't think in percentages. You have to think of the parents of those children.
Yeah.
Now, there are 50,000 that we have on record throughout Pakistan. And awareness is the most important thing. We have, and that's where the media comes in. Spread the word about inherited bleeding disorders. It's not thalassemia, there are other inherited bleeding disorders. And we need to spread the awareness about it. Like Dr. Tahira and Dr. Lubna have just said, that it's not just cousin marriages.
Okay.
I mean, we condemn everyone, कि जी cousin में नहीं करना, cousin में नहीं करना, cousin में, we shouldn't be doing it in cousins.
Okay.
Anyway, because there are a lot of other diseases which can occur. There's mental disease, addiction, things like that, autism, lots of stuff that can that can affect our children when we marry into our families. So, at least my role as a humanitarian and as in the Hemophilia Society is really to spread awareness and to get as many people as possible interested in these inherited bleeding disorders, so that in your villages, in your towns, wherever you go, you spread the message.
Okay, now when you are doing this, when you are creating this awareness, how do people react to it? Are they accepting of the information or do they dismiss it?
Do they come for a blood test or a blood screening?
Absolutely.
Excellent.
Absolutely.
So it makes an impact.
Yes. I mean, you have to, naturally, you have to convince them. And the convincing at times is difficult. Again, people are not very rich. They need to have tests. This is where our societies help them also. If they can't afford it, then we subsidize everything that is needed.
Wonderful.
Blood transfusion in thalassemia. I mean, why are we frightened of giving blood transfusions?
Okay.
We have to give.
Yeah, we will come to that, but we'll come to that in the later half. But the only most odd thing, I might be diverging from what we are talking, but the most disturbing thing about cousin marriages is that you spend 20 years saying or calling your cousin a bhai. And then you get married to the same bhai as well. So
That is very, he's teasing.
No, I agree with you
so
completely.
this is what is most disturbing though.
It is.
Okay, just coming back to the subject, that was a good joke.
But it's a very good point.
Yeah, in between a serious conversation, you might
You
need
have
it.
to lighten the mood
Yeah.
a little bit. Now, because first thing in the morning on Monday, you don't want such a heavy. Now, let's bring on to the psychological aspect. You know, we have the awareness being created, we have the services, and people are subsidizing things. Now, psychologically, it's very draining, because it's something that you are carrying for life.
Right.
So, what are the impacts? What are the problems that people with thalassemia, go through? Depression.
First of all, let's talk about parents, and then we'll move on to all of those kids who will eventually, by growing up, realize that they were born with it.
First of all, since it is, medical ailment, a disorder that stays with you lifelong. So once being diagnosed, it is quite apprehensive. Parents are usually apprehensive. They are worried about the diagnosis in the first place. As ma'am already has said, it is very difficult to, convince them for that they are already diagnosed, their children are diagnosed. So what do they think of for their future? It's like dark for them, because usually we lacking guidance in our society as well. And in addition to that guidance for the proper medical care, in addition to that, we do not have any psychological support also, because families, once we are living in families, we have to inform everyone about certain medical conditions, because without that normal life will be difficult. So for parents, first of all, it is very I think very consuming to admit this thing that child has been diagnosed. And what they see, usually this is all lack of awareness. They think like life is going to be a hell for them. It would be very difficult for the child to study, to pursue the career, or to do jobs and marriages.
So basically,
and all
hopelessness. They feel hopelessness.
There is completely helplessness. Okay. So first of all, they need to be counseled properly. Okay, and then later on, once the child who has already been diagnosed, with the passage of time, with the different social stigmatization, although it is not completely psychological stigmatization, but due to some physical apparent I would say conditions, maybe some physical, I would say deformities. The child, he gets this idea, he has low self-esteem. You know, you are suffering from this disorder. How would
I
you
think
play
even
with us?
if you're ill inside and it's not visible, it's a psychological
Yeah.
trauma. Like, so now that's the thing. So we're aware that they're suffering. So as a psychologist, what I want from you is that how do parents deal with it? Because they have to accept it, because otherwise that child's life is going to be spoiled. So how would you as a psychologist say to the parents?
And then you have to imagine that pressure as well, that the parent knows that whatever the kid is going through is because of me. So, you know,
That's
there's a lot of blaming on your own self,
Guilt.
and I think
But
that
you know,
can lead
once
to quite
again-
a lot of disturbing factors.
Again, number one is awareness. Like, we can make the parent understand that it's not his own fault, because, you know, knowing that, nobody would go for that, to my understanding. And I think this is an additional pressure on the parents as well, in addition to dealing with the child and child's problem, and then their own psychological, I would say, blaming, self-blaming, negative self-evaluation. So to deal with that, first of all, we have to take a system that should be in place in terms of awareness from A to Z, the whole information, how parents are involved, and how whatever has happened already. Now for the rest of the life or rest of the people, we can spread this word. First of all, number one, and number second, while dealing with this child, one has to be, the parents, especially first parents, then family, and then society. We all have to be on the same page, because, you know, providing different kind of information to the child, you know, with that lack of awareness, you might, you know, tell the child that he may not survive any longer, or he may not be able to play with the normal children, he will not be able to study normally. So these things might cause some serious psychological conditions, you know, secondary to this thalassemia.
Okay, so now let's come back to the medical aspect of it. So we've talked about what it is, we've talked about how it's inherited, how it's passed on. Now, let's talk about the more medical issues with patients who have thalassemia. You know, first of all, what complications can actually happen if a child or even adult has thalassemia?
Right.
Dr.
Okay.
Tahira.
So, as I said, the children are anemic, so they're not making, in simple word, not making enough blood. So they get growth retardation, and to prevent that, what actually happens is that they start having blood transfusions, and because of those blood transfusions, there's a lot of iron in the blood transfusion. The body gets iron overloaded, and most of the complications are actually secondary to this iron overload in the patients due to these blood transfusions. But they have
So
to
what
have,
does an iron overload do to the body?
because of the blood transfusion. The
No,
blood,
what is it doing? Like you're saying, the
this
complications.
is
What
what I'm
effect does it
saying.
have?
What effect?
Yeah,
Yeah.
it actually will be deposited in the heart, will have cardiac problems, deposited in other organs, which affect the child's further growth and development, deposited in the pancreas, giving patients diabetes. So there are lots of complications which are due to iron overload. So
But I think there are some other type of injections available which you actually,
yes.
you know,
So you have done quite good research
We
on
try.
thalassemia.
for,
So there
for
are
the iron thing.
That's right. So there are lots of treatments available. The gold standard was desferrioxamine, which was used to be given by injection. But the problem with that was that it used to be given under the skin for about 8 to 10 hours every day. So you can imagine, once the children were little, their mothers would actually, with a stick or whatever, would force them to get this. But as they grew into, like, in their early and first decade or so, they would actually refuse to take that. Unfortunately, because of that and because of research, there are now lots of oral treatments are available. Desferesirox, which has got different trade names, is available. So now oral treatment is available.
Great.
Yeah.
But what type of lifestyle do thalassemic patients enjoy?
In Pakistan, unfortunately, I mean, we can compare this to the Western lifestyle also. Thalassemia in the West, you hardly ever know that this person is thalassemic. They grow up, become normal adults, have marriages, get children. Here, a thalassemic child will be either in the bed at home or in the hospital having transfusions, because they require transfusion every 3 to 4 weeks, or in later ages even earlier. And with all these complications, it's mainly because we don't have enough blood to transfuse them.
We do not have enough blood donors.
We don't.
Yes.
That comes
Okay,
in-
look,
yeah.
I'm just going to pause you there for a second. I
Yes.
want to bring Dr. Munawar back into the conversation. Now, this is really interesting. So, when because you work on the welfare of the patients. Now, this blood donors, the different treatments. In the West or outside of Pakistan, people are enjoying a normal lifestyle. But over here, we're still very much in the dark about this
Yes.
illness. Now, going forward, how do you make sure that these parents are not going to be also a hurdle in this child's life? Because at the end of the day, parents can also do that by trying to protect them. Oh no, don't do this, don't, so you're mollycoddling the child. So how do you work with the parents to say that, yes, this is happening, but they can still live a normal life?
It's not really that difficult to convince a parent. I mean, it is difficult because there is love there, right?
course.
And as you say, you want to mollycoddle a child with thalassemia or hemophilia. You don't want them to get disabled, you don't want them to get hurt, but you
Yes.
want them to lead absolutely normal lives. Again, we are back to that same thing as treatment. Now, if those children could get proper blood transfusions in time, and the parents are convinced that this is the only way, they'll be going regularly for treatment, and they can attend school. As Dr. Tahira just said, it's 3 to 4 weeks. Why can't they lead a normal life within those 4 weeks if we can make the families and the schools, everybody aware of these illnesses, so that those children are given the special care they are needed. It's like for instance, in hemophilia, you have to protect them from joint problems and things like that. If they go to school, it's not just, you have to convince the teachers, you have to convince the children they
It's a lot
play
of
with.
convincing, isn't it?
And yes, it's a lot of convincing, and we need people like
their own
Usman.
mental health is also compromised because
Exactly.
Obviously.
continuously they are seeking the attention, and definitely they are learning that they are totally helpless and they definitely need this.
They're being told they're victims.
Exactly.
I mean, they're ill.
But then at the
Yes,
same
that's
time, what I wanted to ask, Dr. Lubna, I'll move on to you. What I wanted to ask was that, as Dr. Tahira mentioned, that, in the West, everybody can lead a normal life, whatever disease they might have. So what are the basic differences in between all of those treatments which we have over here or the West applies?
Yes, that is a very pertinent question.
Thank you.
In the West, actually, there are, like thalassemia was associated with the Mediterranean countries. They have actually almost eradicated it by awareness and by making it mandatory to get it checked before getting married. So hardly any new thalassemics are being born there. So things have been controlled pretty much there, and then they have developed bone marrow or stem cell transplant, which is the curative treatment. Actually cure is possible, and they have actually developed that. The Italians.
there are repercussions to that as well.
We should have had the stem cell people on our show
Yes,
today as well.
and then coming to our situation, we do have bone marrow transplant centers, but then they are not affordable and not available for most of the patients.
Painful, no?
And
But
they
then
are-
at the same time, would you ever suggest to get a bone marrow transplant from over here in Pakistan? Because you have to be very careful that the infection does not get into the room and all of those procedures.
Yes,
they're
the
very
centers
sensitive.
who are doing it, they are obviously following very strict guidelines, and they are doing a good job actually. But then it is not affordable. Most of our patients, they can't afford a blood transfusion, what to talk of bone marrow transplant.
But then
And
bone
then
marrow
there are-
transplant have got a lot of other repercussions as well.
Yes, but so are there with the blood transfusion,
transfusion.
because blood transfusions, one thing, they are not available as readily as one would like, and then there are so many other problems with blood transfusion.
But I think-
We're going to talk about that.
But I think
We're going to talk about
don't
Disease
do that.
transmission is one, so hepatitis B and C, that is associated with this.
Dr. Tahira wants
We'll get that out, but after a short break. We just need to go for a very short break. And ladies and gentlemen, when we guys are going to come back, we'll get it answered. Don't worry, we'll get you all your answers.
Stay tuned.
Let's take a break. Good morning.
Welcome back, everyone. And before the break, we were discussing the situation in Pakistan because yesterday was World Thalassemia Day, and today we're learning the situation in Pakistan, what's happening, and we're having a very interesting discussion on the medical aspects, the social aspect, and the psychological aspect. So we're going to come back to Dr. Tahira. So what are the repercussions of having a bone marrow transplant?
The thing is, the only curative treatment for a child with thalassemia is bone marrow transplant.
Okay.
So as a parent, if there's death on one side, a sure death, and treatment on the other side,
So whatever may be the repercussions.
whatever the repercussions,
Exactly.
as a parent, I can say I would definitely myself also
Because a
choose
disturbing
that.
fact, I mean, I'm going to say it because the guests don't want to say such negative things, but the life expectancy of a person suffering from thalassemia, right, is 20 years old.
Maximum.
Maximum.
Sort of there might be few who have been treated well, like on the Western standards they might have, but majority of the people.
And even, you know, on the other hand, if you get a bone marrow transplant, then you'll have all of that expectancy, which actually, you know, God might have written in your hand as well. So
Yeah,
I think
if it is successful.
If
the
it
if
bone
it is
marrow
successful.
transplant.
Now,
Yes, because
what
can
makes
afford
it
it.
successful? What about all those parents who are actually thinking about going for a bone marrow transplant?
Yes.
What do you think they need to be careful about, and how many chances or what chances are there that it will be
Actually,
successful?
it's easier said than done, because for going to have a bone marrow transplant, you need actually a matched donor. So that is easier in Pakistan because we have many siblings, but not. So there is a chance that you get a matched donor, and then the story actually starts that you can actually do a successful bone marrow.
Do we require a 100%
transplant.
match or a 90% or a 80%
Yes, people like to
match?
work with 100%, but then if it is not possible, then obviously lesser degrees of matching has to be resorted to. But ideally 100% matching is required, and there are centers which are actually doing that. But then we are actually talking on a larger scale. Unfortunately, most of our patients, they cannot afford, and they have to resort to blood transfusions, and then blood transfusions, they are not easy to get, like we have already
Now
talked.
let's talk more about this blood transfusion, like just a little bit more. So the situation. So we have a screening problem within
Yeah.
Pakistan.
Yep.
Do people donate enough? Tell me,
Not
Dr.
at
Tahira.
all. I think that's one of the biggest things. I mean, we are now focusing on treatment. That if we get enough blood, then we can actually treat these patients properly, giving them enough blood so that they grow normally, and then we can get rid of, as I said, the iron. But I think we are actually going more on the treatment side. What I would like to say is we have to focus on prevention. That is where our salvation lies. And there is a national control program by the government of Punjab.
Great.
I think there should be proper implementation and proper awareness that this program is available. They'll get free tests. They'll screen you.
See, that's the thing. There's
yeah.
a lot of things that that are in place for all the
Yes.
citizens of this country, but there's no awareness. You know, these people
So
need to
that
be
is
told.
why it's so important, and I'm so glad that PTV World has taken up this this fight and supporting all of us to prevent this. So we really have to have a good national control program which goes ahead and we can prevent thalassemia, and it has been prevented. It has been shown in countries like Cyprus and Greece, which is much higher population of thalassemics. They are now thalassemia free because at their marriage they have to show that they are not carriers. And in case, like you said, if somebody falls in love with somebody else and you want
Or
a
arranged
carrier,
marriage, whatever.
yeah. So in that case, they can have a prenatal diagnosis and then do that. So that is the main thing which we focus at. And the theme for this year, World Thalassemia Day, is actually safe and effective treatment for all of thalassemia. So that brings us again to the blood transfusion drive. I think it's very important. That is again an awareness, because most of the people, when I've been to blood camps, they think that if they'll donate blood, that some sort of heavenly energy will go out of their body and will stay out of the body for the rest of the life. It's not so. Normal blood, actually, our red cells are destroyed every 3 months or so, and we get new cells. So if you donate that blood to somebody else, your bone marrow or the factory which produces blood will start functioning more actively. And it's not only that you'll be happy about doing a good deed, it will be that your you're actually benefiting your system by making it more effective and active.
Exactly.
Okay.
Very well said. But then at the same time, what I wanted to ask was, Dr. Munawar, I'll move on to you. That, Maha earlier even said that, what about all the donations other than the blood donations? Because Pakistan stands at #1 as the most philanthropic country. So then, if people over here within Pakistan cannot even get blood transfusion done by their own hands and with their own cash, how are we working on
Well,
it?
you can't buy
the
it.
blood.
You can't buy blood
You
actually.
shouldn't buy blood.
Someone
Okay.
has to
Because
donate it.
professional donors
Yes.
normally have diseases or are anemic. And the awareness is that, like Dr. Tahira just mentioned, donating blood every 3 months between the ages of roughly 18 to 60 will do you good. I mean, I won't say that pregnant women and all, there are certain conditions where you can't donate blood, but an average gentleman can donate blood every 3 months, 4 months. You must have heard
Or at
yesterday-
least twice a year.
Or minimum twice a year.
No, but then hospitals might be charging something. And,
They shouldn't be. It should
Not for donations. There are
Not
no
for- they
charges if you want. They want to take you with force
And
rather
if the
than
hospital
asking
is
you to.
doing
No,
that,
there's no
Yeah.
no
walk
charge
away.
for
In
donating
in fact,
blood.
the blood banks that are unethical,
Yes.
they pay the donor and then they sell the blood, and they don't have the proper screening methods.
Yes.
And that's where the problem comes in, because you're spreading HIV,
Hepatitis.
hepatitis B.
Bad.
And
No,
that's-
I have a question.
yeah.
I want to just move on to Dr. Usman. This blood transfusion, this, like Dr. Tahira was saying, if you donate blood, something bad will happen, or, but psychologically, why are we not doing it? Because Shahzad, I was talking about this with my dad before he left. But we were talking about this, how Pakistan is people are wonderful. They're very hospitable. They're loving. They
And we
will
have
give
very
you charity.
strong family support
But we
system.
give money. We give money. But when you need to give blood in order to save people, but we're not doing that. What's our psychological block?
I think again that they must not be informed properly what are they going to get that from it. And in our society we are fortunate enough to have a strong family system, support system, social system. Whenever in case of general disaster, you can see the enthusiasm of the people. They come and they donate whatever they have.
They help,
So
yes.
we can simply educate them regarding this all, and I think we definitely will get a very good response from our society, because they are very supportive. This is all their lack of awareness. Maybe they don't know much about that.
Okay.
No, but
And nothing else. Nothing
Yeah.
else.
Myths also.
Yeah.
We'll move on to the myths as well,
Actually,
but I've got an
donations,
example.
I want to-
Since you just mentioned about the unethical practices of the blood banks, now I still remember that there's this society, who actually go to different university and then take blood out of the students, and then they say that, if you need it ever in life, you can just come to the blood bank and take it and just bring this receipt. So once I was in need and I was a blood donor myself, so I went over there. They refused. Right on my face, they refused, and I was like, take a look. I've been a blood donor since now 2 years, and I don't know how much blood I've given. And then they refused. They're like, we cannot help you, just go back. And then since then, I went back to my university, ran a proper campaign, and now we do not entertain them as well. So now, how do we challenge these unethical practices?
Especially if you don't have this financial, economic
Yes.
support.
Education, like you said, you did a campaign in your
Yeah.
university. I think it's just off the top of my head now that you've asked this question, is what if you find out a good blood bank, right, that that does screening, things like that, and you have an understanding with them, the university has an understanding
Yes.
with them, that if any of our students need it, we will have an annual blood drive, but if any of our students or their parents, immediate relatives need a donation, you will give us then. And of course, because you're giving, it's like an insurance.
Yeah.
Actually, also, we could convince people in the West sometimes when there's elective surgery, you donate your own blood. And you have because you're perfectly healthy, the surgery is elective, and when the time comes for that elective surgery, blood is ready for you. It's not that it's your own blood, but you insured that you will get blood whenever you need surgery. I think the blood banks and people who are in this field, and of course, as I said, partnership with universities, because students are the ones with both jazba hai, students with, is to link up with them somehow. And we do have blood banks. We have very ethical blood banks. They ensure that
Please name them.
Well, I worked with Halal Yammer for some years, and I know that they would right up to ELISA and things like that. They were doing the testing.
And Armed Forces Institute
And
of
Armed
Transfusion
AFIT,
is a very good blood
AFIT.
bank. They're very ethical, and they do all proper screening.
And also, it's all about doing your research too. Look, we can spend hours on our phone, on Facebook and social media and God knows what website. If we care about people like we say we do, we can research and find a good blood.
But then before we run out of time, what
Yes.
were the myths you
Well,
wanted to mention?
one definitely I know of.
Yes, tell us.
Quite funny. A husband won't donate for a wife. Nikah toot jayega. Exactly. Look at your expression.
People are really
I've never
crazy
heard
quotes.
of this.
Yeah, people
It's happened in my practice. It's happened when I was doing general practice. The husband said, "Jo marzi ho jaye, I will not give blood."
Wow. So lack of awareness. Does that?
And it's
lack
not
of
necessary
awareness.
that the same blood is going to be given to the wife. Maybe it will go
And
into
it's
the
not
bank and
yes.
some other blood will be
And it's
given
not
to
like
her.
here to here that you're
Yes.
giving, but you have to
Like in the
tell them-
movies, you see that people are lying.
Movies have really messed up.
It doesn't
people's
happen like
minds.
that. You have to obviously check first whether it is suitable,
And the
and
fun-
then only you
The funniest was
transfuse.
when we told a man that we need blood, and he comes with a bucket and says, "Main ja raha hoon to the
Oh God.
blood lene."
But when I was mentioning about this, the donations which people actually gave, it is not for blood transfusion. It can be used for these iron chelators, because it's not only blood transfusion. Once a person gets regularly transfused, then there is a problem with iron overload, and for that we need these chelators, and they are very expensive. So donations can help these patients with these, and then they need to get vaccinated. And then obviously usually maybe 1 or 2 or 3 children in the family, when they have this problem, unfortunately, then it's a real problem. They cannot afford, with this socioeconomic condition in our country, people are not that much affluent that they can afford the state-of-art treatment. So that is actually a problem. So again we come back to prevention, and that is so important.
screening, and the
And
government
we
does
can
that.
start with the families which are actually
Yes.
suffering. So let's focus on that, and cousin marriages should be avoided in at least those families.
Or probably
And-
get the
Or just
proper
get your
checkup done.
Yes.
get proper
Checkup,
checkup, because in the West that's
Yes.
what we do.
Checkup,
But doctors, just finally, just for all the parents and patients out there, what would you say to them? The ones living, this life and
Okay.
trying to get through it.
Exactly. For the parents, I would rather say acceptance to the reality is more important. I think whatever has happened is now happened, and as we all welcome, not exactly welcome, but at least accept different misfortunes in our life. But this is, I won't label it as a misfortune. It is just a condition, kind of. In a sense, I would say. Imtihan, kind
test.
of a test from our Lord, and we definitely have to submit, and keeping ourselves aware first of all, and then being resilient. It is very necessary for your own mental life, for your own mental health, because you have to carry out your routine activities as well. You have to take care of your family, your children, and everything. And I would rather say parents should be regularly counseled. They should be problems should be discussed with them. Regular counseling should be provided to them.
Okay.
Very
For
nice.
the moral
But
support.
one last thing, very
the
quickly.
caregivers are actually totally ignored in our society, unfortunately.
actually,
Although they
that
bear
is-
the brunt of the
But
problem.
one last
Quickly,
thing, very quickly, which
quickly,
is very
literally you
important,
have
and
10 seconds.
it might be stigmatized as well. Do you think abortions are an option for all those parents who think that within their pregnancy they get to know that their child is going to be thalassemic?
It's a very difficult decision for a parent.
Okay.
But basically, abortion can be legal if a doctor
For medical
sanctions-
reasons.
medical, a proper medical
So you have to get
certificate is
proper test.
And there
And
are fatwas
yes.
where it says that in the first 3 months, like 12
Yes.
weeks, if you know that the child has thalassemia, you
Yes.
can actually get.
And parents who have a thalassemic child, they actually are more easily convinced as compared to those who.
they're aware of the problem.
I'm sorry,
and
we've run out of time. We've actually run out of time. We have to stop
Thank you
now.
very much.
Thank you
Okay.
so much for
Thank you.
joining us today. And
Thank
we will
you
have
for
another
having
show
us.
because we didn't get through everything, despite actually getting through quite a lot.
Yeah.
But the situation is not good in Pakistan. The government have got programs and systems in place that you should go and get screened, because prevention is better than cure.
And then at the same time, the only thing which I'm going to mention over here is for all those parents who are actually looking after their kids, who suffering through this disease. Now the thing is that if you know that there is another foreign military who is charging on your border, you have to make sure that all of your armed forces are there at the border defending from that army. And this is how it goes around with health as well. So don't forget to write to us on our Facebook fan page, which is with the name of
Well This Morning.
on Twitter,
Well This Morning without a G.
on Daily Motion,
Well This Morning.
on YouTube.
Well This Morning.
And the fabulous repeat is going to be at
5 past midnight. Like after 11 p.m. today, it's on at midnight.
Yeah,
No,
so-
because everyone after the show always says,
Yeah.
what is the repeat?
1, 2, 3.
Good morning.